My name is Nathan Rutatina. I'm a clinical officer originating from Rwanda. I hold a bachelor's degree in that field, and I also hold a master's degree in public health. But besides that, I am the chairperson of Rwanda Medical Clinical Officers Organization and a pioneer of Global Association of Clinical Officers and Physician Associates. What it takes to become a clinical officer: you have to go to the university, a medical university. You take 4 years. Within those 4 years, it includes other months of practice per year. It takes 4 years. Now, it is only one university, and it is a public university called University of Rwanda. It was started by the government upon a request by the Ministry of Health, depending on what was existing and what is currently still existing. And what is existing is the scarcity of health professions, including the medical doctors, including the nurses, and other health professions. So it was an idea that came around, and it was like, if this mid-cadre is brought about, it can fix the gap that is around related to the scarcity of health professions. It was brought about in a sense of doing task shifting some tasks from many tasks actually from medical doctors and some few tasks from nurses, to bring them together to formulate a new profession, which is of clinical officers. Once a Rwandan clinical officer graduates, he doesn't go straightly to clinically practice. Once he or she graduates, we've got a regulatory body, and it is called Rwanda Allied Health Professions Council. What it does, it welcomes a fresh graduate, and then that fresh graduate does an exam related to getting the license of practicing clinically. So after getting the license, a Rwandan clinical officer then is allowed to practice clinically. This profession is very new in the country. There is a very long journey to travel. However much there is a long journey to travel, we still have a journey that has been traveled. The Ministry of Health has tried the best to bring the profession in the space of practicing, but still it's not 100%. We still need another percentage from the ministry. We are expecting a lot of things from the ministry in terms of political will for a clinical officer to practice clinically. A clinical officer can practice from a health center and a district hospital. When a clinical office, it's obvious that when a clinical officer is at a health center, no big number of cases will be transferred to district hospitals in Rwanda. A clinical officer at a health center can work with other professions, including nurses, to provide a heavy package of healthcare service to a patient. Now, coming to the question of GACOPA conference, point number one, as a benefit of GACOPA conference, networking with other fellows from different countries, from Malaysia, from Kenya, from Uganda, from South Africa. Not only that, learning from them. How have they been doing to achieve the goals related to the success of clinical officers in their countries? You've seen those countries doing well, countries like Ethiopia, but we need to see what they have been doing with clinical officers, such that we can learn from them, and then we use the knowledge and evidence-based advocacy to see how the profession here can also be integrated in the healthcare system, such that it can clinically practice. There is a very big sign of hope, simply because when you deliver a child will not walk directly. There are some steps that do come first before the child goes to school. The message to my fellow clinical officer students and to my fellow clinical officers graduates is that this program is still a neonate, is still a new program in the country. Things do not come directly. Things come step by step, and things do not look for you. It's you who look for them. So we need to put together and work together, as I think we've been doing, working together to achieve or to reach the level our fellow clinical officers in other countries have reached today.